People wake up on a normal day and suddenly something happens that changes their lives completely.
Pediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
I think it's going to be one of those days.
A place where life...
Darling, what's for dinner?
Love...
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Good morning, good morning.
What's the surname? Sorry.
Cannot wait for my bacon roll.
You getting a double one this one?
Yep, double sandwich today. Good treat myself.
I think it's going to be one of those days.
Hello, where are you calling me from, sorry? McKissick, you believe in orthopedics?
Trauma Dr. Mo is one of the team in A&E today.
Is this the guy with the C5 jumped facet? Yeah?
As a trauma registrar on call, you're a wanted man.
OK, thanks. It's done, yeah? When I have a moment, I'll come and see the patient and let you know.
You're wanted in resus, you're wanted in majors, you're wanted in urgent care centre. Sometimes you're wanted on the wards. And if you don't, thrive off pressure, then it's doomed to failure.
Thank you. Bye. I've got to be 15 places at once.
Shall I just make 15
Yeah,
parts of
let's do that. You enjoy it, won't you?
Some people draw parallels between orthopedics and carpentry. There is that thing of, building things together. You've got screws and you've got plates and you've got bolts and you've got whatnot.
Where's your gown? Breaking protocol. You should be wearing a hat either.
I did enjoy DIY when I was younger. When we buy some furniture, I'd always volunteer myself to put it together.
I'll be back.
I wanted to become a doctor because that's what my dad wanted for me. He wanted a son who was a doctor to be proud of. It's the cliche, my son is a doctor.
Hello, St George's Emergency Department. Medical trauma. Yeah. Yeah. So high-speed RTC, moped into a wall, did you say? Yeah. Full amputation below. Cheers. Bye.
Yeah.
Code red, adult trauma call in 25 minutes. Code red, adult trauma call in 25 minutes.
A 29-year-old woman is being airlifted to St George's after crashing her motorbike in Essex.
So we have got a 29-year-old female, high-speed RTC moped into wall. Yeah, code red. Complete amputation. Below leg, below knee. I've activated the helipad. Yeah, I just need someone to type injury sites for me, and then I'll come back and load them up. I'm going to read blood bank. So we booked in, Grace.
Consultant Jay is in charge of Resus today.
They haven't bringing the leg with them, are they?
They've tourniqueted the leg.
When you say code red, you get a patient who lost a lot of blood and they are critically unwell. It is a distressing situation because you don't know what you're going to face.
Never a dull moment in A&E.
You all signed in? Your anxiety levels go up. And it could be minutes, which could change one way or the other, whether they survive or they die. I'm going to just go and shout through the code red checklist, okay? Major trauma, hemorrhage protocol, blood bank are aware, defrosted FFPs are here. If he's pretty cold, we may need a bear hugger at some point just to keep them warm.
The woman's mother and grandparents were called to the scene of the accident and are now travelling to St George's by road.
It was tea time. I was doing tea. I'm going to go out on my bike for an hour. And then on went the gloves, crash helmet, and got herself ready, kicked the thing up, and slowly out the driveway and looked away. And I could see her now going out of the drive and into the road. That was that. Then we got the phone call.
We just left everything, jumped in the car and run down there, and we just see Kerry lying in a ditch. Well, my stomach nearly fell out.
My heart stopped beating. When the lady said, "Don't come near her, don't come," I thought that was it.
I see these two fellas running up and down the road, and I didn't know who they were, and they didn't know who I was. And I said, "Excuse me," I said, "What are you looking for?" He said, "We're looking for the young girl's leg."
Okay, guys, trauma is here.
1, 2, 3.
Due to the severity of her injuries, specialists from 7 different departments have been called to receive the patient.
Okay, can we get a quick handover from the HIMSS guys?
Yeah.
Okay, so this is a 29-year-old lady. She was riding a large motorcycle, high speed, came off the road, unknown reason. We are thinking she hit a wire holding a pole, so that skeletoned her right lower leg. Her leg was found about 20 meters away from where she landed. She has been tachycardic, sweaty, and pale right from the beginning. She has had 1 gram of TXA. She has had 1.2 grams of Ventin. The last dose of rocuronium was 30 milligram, just given 5 minutes back.
If you actually cut off your lower limb, the worst thing that can happen is they can actually lose the whole volume of blood, and as a result, your heart goes into a cardiac arrest and stops, and people will die. So I suggest as we carry on with the Belmont, get the 2 units through. We need to get some bloods and another decent access.
We begged her, literally begged her not to get it. But Kerry desperately wanted a motorbike, so she went out and got one.
monkey, 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 monkey.
Good off eBay. That's a little first aid kit. Look at those cute little scissors.
That wouldn't even cut one of my hairs in my arm.
I did cut a tissue with
Cut a
it.
tissue.
Wee, the elephant sneezed and fell on his knees, and what became of the monkey, 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 monkey?
I don't know, I have a needle in my feet and it's hurting me so much, and now I can't even feel my leg anymore. Fucking hell, they're trying to kill me in my own house.
Okay, we're on our vent.
You happy for me to start?
Just careful, because that's yes, you can start.
You're happy with the airway?
Yes, I'm happy with it.
C-spine is immobilised. Trachea is central. Sats are 98. Can't get a radial pulse.
Dental nurse Kerry arrived in Reus 14 minutes ago after crashing her motorbike into a ditch.
Abdomen is soft, is non-distended.
Completely severing her right leg below the knee.
No obvious deformity to the left lower limb. Obvious deformity and external hemorrhage to the right. There's a traumatic but no knee amputation, which is complete.
Doctors need to stabilise Kerry before they can send her for a CT scan.
Guys, blood pressure is 90 systolic.
Okay, that's probably because of the propofol.
I need trauma tape, please. Trauma tape.
Time is very critical, particularly when we are considering reattachment of the leg.
Okay, X-ray.
But the first priority is always life. Limb comes second after life.
You're going to be able to get bloods out of that one?
Yeah.
Perfect. So we've got a 20 ml syringe.
So once she's stable enough, we've got a line in.
18 months ago, Kerry moved in with her grandparents after returning from travelling.
Kerry's a very independent girl. If she got the slightest notion that you didn't want to do anything for her, she'd say, fair enough then, Grant, you know, don't worry, I'll make other arrangements.
There's no obvious flail chest. I think there's surgical emphysema on the left.
She'd put that motorbike in gear and let the clutch out and she'd just cruise off. But if she'd have known that we'd have been watching us, she would have had a right go. She wants to do everything herself.
Pelvic X-ray looks like she's got opened up a left SI joint on the left-hand side. That's what it looks like.
We've got blood pressure.
But our heart was in our mouth every time she went out on that bike until I heard that motorbike come back here.
We're not going to roll, we're just going to brace, that's it.
Steady, brace. Okay, right.
Guys, chest X-ray looks okay. There's no obvious surgical emphysema to look at. Lungs are inflated. Some blood products into CT.
She was just a very confident girl. She passed all her dental exams with flying colours. I mean, she passed a driving test first time and a motorbike test first time, and she used to do all the proper reading up. I mean, study the highway code book every night before she passed a driving test. She drove a 360 digger on a building site. There's some blokes in this country can't drive them, but she could.
Yep. Yep, let's put the bear hugger on top of her and warm her up.
She's relatively stable. She's on propofol now. So we should be okay to go.
She was just a good, gutsy girl.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I'll see you soon. Bye. I love that question. I love. What's your opening hours?
Yeah.
I don't know, I'm just waiting now for them to call me.
19-year-old Tina is in A&E after stepping on a sewing needle.
I'm in a emergency and accident campus in the hospital.
She's awaiting the results of an X-ray.
Yes, it's me now. Okay, bye.
Right. Have a seat in the chairs. My name is Mario, one of the nurse practitioners.
Nice to meet you.
Yeah. Tell me what happened.
I stepped on needle and the half of the needle is inside my foot.
Uh-huh.
It broke and I have...
When did this happen?
Last night.
Okay. Any other medical history I should know?
No.
No? You're not allergic to any medications? Do you smoke?
Yes.
And how much do you usually drink?
It depends. If I go out, I drink. If no, I don't. Why does that matter for my feet?
It's part of the history. Can I just have a look at the foot? Tell me when it's painful.
It's up somewhere there. Ow!
All right.
Can you feel it?
No. Surprising, it's quite deep, so you need to be referred to the specialist. Have you got any questions?
No.
You seem to be worried.
Yeah, but what if they cut my leg or something?
They will, obviously. But
they will cut all my leg?
No, they will make a small wound to get the needle out.
I'm not gonna get any disease if this is dirty and it made infection in my leg?
Well, have you had a tetanus injection before?
I had, but like long time ago.
How long was it?
Long, maybe years or something.
You have to tell me how many years?
I don't know. It's at least 3 years ago, at least.
Yeah, you're still covered.
How am I still covered?
Well, it says you're covered for tetanus for 10 years after you had the injection. So you're still covered with tetanus. You don't need to have another one.
I'm gonna ask my mom.
All right. I'll be back in a minute. I'm just going to get your notes, yeah?
Мамо, знаеш кога за последно ми е бита инжекция за тетанус? Казаха ми, че за 10 години е валидна всяка инжекция. Това глупости ли са? За да се извади това нещо, защото е супер голямо. И ма дразнят. Казаха, че е много зле. Казаха, че това нещо е адски навътре. Целия бика нищо не усеща вече. Никакъв лекар не идва, никой не идва. Седа изобщо ни пука за тебе. За какво стане лекари?
On 3, ready, 1, 2, 3. Good.
Okay, blood pressure is 136.
Okay, so I've restarted sedation already.
Okay, cool.
It's been 2 hours since Kerry severed her leg in a motorbike accident. A CT scan will help doctors establish if they can reattach her leg.
I've got 2 daughters. If I see a young girl comes in, it becomes very personal for me. I want to make sure I can do everything within my capacity to make them get back to being as normal as they can.
Kerry was a 110% perfectionist. Her hair had to be just so. Her shoes had to be matching with her dresses. She was just perfect. She'd come down here, say, let's have a look at your love before you go out. And she'd do a twirl in the front room, like, you know. You know, I've got 11 girls in my family, and with my 2 daughters, 4 granddaughters, and then 4 granddaughters of my good lady. Well, I'm the only man in the family, so I've got to be strong, haven't I? We're a very, very close-knit family, and we worry about every one of them. I always vetted all the boyfriends that she's ever gone out with. Much to her disgust, I might add. But I did worry about her.
We'll send the leg up with you.
Hello, St George's Emergency Department.
An 11-year-old boy is being rushed to A&E with his nanny after a prolonged seizure.
Medical trauma. Thank you.
His parents have been notified and are on their way from work.
Pediatric priority call in 5 minutes. Pediatric priority call in 5 minutes. Thank you.
Luke needs a lot of care. Luke needs endless care. Epilepsy is an evil disease, and it has a mind of its own. How and when it chooses to manifest itself is just beyond me. It only takes one of those instances to, to take him away from us permanently.
I'm Nanny. Mum's on her way.
You know, your little child surrounded by doctors and hooked up to all this stuff. Just jerking and jerking and jerking. You just know that the longer it goes on, the more harm it's doing to him. There's nothing you can do. It's horrific. It's really horrific.
I know Mommy's here, darling. Don't worry. We're gonna feel better soon, okay?
Luke has a form of complex epilepsy, which has left him with severe learning difficulties. He can have up to 3 seizures a week.
I think it's a blessing that Luke was born to Catherine and I. We have the capacity to love him a lot, and we're in his corner fighting all the time. You say to yourself as a parent, am I doing enough? And I can assure you that question leads to a level of exhaustion that is incomprehensible for other parents. It's an awful, awful situation.
Oh, they're up there.
You're always second guessing because you're like, oh, he'll be out of it in a minute.
How do you normally spend this day?
Oh, brother. Do I resent my son's illness? No, absolutely not. Do I become jealous of parents that have normal children? Without a doubt. I'm jealous of parents that have normal kids. You're different from other people. That's the way it's going to be. It'll probably be that way for the rest of your life.
Give it to me 1 time. Give it to me 2 times. Give it to me 3 times. Hey, sweetie, I'm just going to pull you up a bit.
Okay, honey. Okay. Okay, sweetheart.
Luke has been brought into St George's while suffering an epileptic seizure. He has stopped fitting and is being given oxygen and drugs to help stabilise him.
Okay, honey. Okay. Hello.
I remember the whole process of Catherine being pregnant.
Okay.
And I remember, you know, taking photos of her.
Hello, darling. People tell you that you're going to fall in love with this child, and you don't really realize what that means until, you know, you hold the baby in your arms when they're born. Okay, sweetheart. Okay. You just rest, honey. You just rest. Oh. I know, nobody likes all this stuff. I know, darling. I had, you know, normal pregnancy, normal delivery. Everything was fine when he was born, and actually, you know, milestones were normal.
Yes, at home. Yeah, that was at home, and then in the ambulance as well.
At about the age of 2.5, he actually had, within the space of about 2 months, 2 very long seizures. And we saw a real change in his development from then on. You know, kind of the speech that he had, he lost some of it. It didn't progress. You lie down. We're going to go in our special room in a minute, honey. So we can he was just slipping away from us, really. Let's go. Let's go. Hey, no pulling that, please, Lukey. Put your legs down. That's like a frog. Yeah, come on.
Pediatric doctors want to monitor Luke before deciding if he is well enough to go home.
Us women drivers are the best.
Of course, I totally agree with that one. You're both so stressed and worried about Luke that you do, especially at the beginning, have these arguments about we should give him more drugs or not more drugs or whatever, and it can place huge pressures on your relationship.
Is Pediatrics down through there? Yeah.
But we've managed to come through it, supporting each other and, you know, probably being stronger than ever.
You begin to realize that you're in a certain level of denial. I thought that he would go to school. I thought that he would end up being at college. As the father of a single child, inevitably you're always thinking, even well beyond that, you think, oh, he's going to have his own family and I'm going to become a grandfather. Subsequent to Luke's disabilities, it's not even clear whether, you know, he's going to outlast me or I'm going to outlast him.
Okay, honey, what do you need? What do you want?
Should I get another pillow?
Okay. You still hope that the learning will pick up again and we'll make up for lost time and we'll support him and we'll get him, you know, we'll get him back to where he should be. And I think accepting that he will never be where he should be is a hard one. And I think it takes a lot of time. It takes a lot of time because you have great hopes for your child when they're born, and you know, accepting that that's not going to happen is actually really hard.
I have, how do you call it? Nude, needle.
It's just there in the web space. I'm going to cut it and pull it out.
So then tomorrow no work. Let me call in a bit.
Christina?
Yes.
Hi.
Hi.
My name is Mr. Tahir, I'm one of the orthopedic doctors.
Nice to meet you.
I've looked at the x-rays, obviously there is a needle there. It's not too
bad.
far. Hey?
Is it bad?
Well, there's a needle in there, it needs to come out really.
But I'm not gonna lose my leg or something, yeah?
No, that shouldn't happen. But do you mind if I have a look? I think, why don't you pop yourself on the bed?
It is actually really painful.
Everything is relative. a very small injury to certain individuals could have a massive impact on them and their mental state. So when we give you an injection, that's going to be painful. The local anesthetic will be painful.
Where do you put it?
It'll be around that site here.
Because my mom told me I can die from that.
Who said that?
My mom?
No.
Yeah.
No, you shouldn't.
Because this, it can go like here, he can go in my stomach, in my heart, it can kill me.
No, that's not going to happen. You go up from time to time against mothers. Mums think they know best. They did bring us up and raise us, etc. So they're always going to have that sort of edge on you. Do you want to watch? Do you want to lie back down?
No.
You're more comfortable that way. Because you can't see. It's all the way on the other end. My mum, she has all these natural remedies, and I say to them, it's absolutely useless. I don't want it. I don't know, they cook up all of these sort of broths and weird magic potions and stuff. Don't worry, this is going to be fine, OK? I just prefer paracetamol. OK? The fact that you've been walking is not a good idea, because every time you walk, you might push.
One woman from there, she told me you cannot stay here anymore, you have to go there, and she told me you have to sit here. So I saw like 5 people who
don't worry about those.
Like
just
and it was so bad smell, so I just went out.
OK, don't worry about it. We'll
it's
sort
not my problem.
OK, that's fine.
It's the stuff in your business, hospital, whatever.
OK, lie flat for me. Just, yeah, that's
just
fine.
keep it like this, yeah?
Perfect.
You sure I'm not gonna be disabled after you cut my skin, yeah?
I'm pretty sure you're not going to be disabled.
Pretty sure?
I'm 100% sure you're not going to be disabled as a result of this. Everyone fears the worst when it comes to their health, and sometimes even we're guilty of having an imagination. Sharp scratch coming up. You ready? 1, 2, 3.
Ah!
Sorry, darling. Just breathe in and out. I'm not a hypochondriac, but what I will say is man flu exists because actually you'll find that estrogen is protective against flu. The estrogen hormone, obviously being a man, you tend not to have that hormone. So man flu is not, it's not myth. It exists, so it hits us harder. Yeah, no, this takes a few hours.
A few hours?
For it to wear out.
Well, you can't find it?
Not yet, I can't.
Just look for it.
Dental nurse Kerry has returned from the CT scan.
How long's it been now? So 2 hours tourniquet. I mean, we're not gonna...
She's been mad on pink since she was a little baby. Her horses had to be pink. Pink up the side of her black boots. And she had, like, pink on her helmet. She don't mind getting stuck in, you know, cleaning the stables out and feeding them and watering them, and she don't mind what she does, but when she's done it, she's done a good job.
We should be okay to go.
Kerry is being taken to theatre to operate on her leg, to give her the best possible outcome.
I worked on a building sites all my life. I used to take her to work with me on a Saturday, and she'd find a heap of sand somewhere and play with that, or stack bricks, or just done whatever she wanted to do. I used to take her down to the cafe for breakfast, and she loved that. What time we going to breakfast, Grandad? We always had this little bond, you know.
no, we leave that on, honey. We have to leave that on for later, okay? Just leave it, please. Okay? Or Mommy's going to turn your DVD off if you don't leave it, please. I'd love to have a chat with him as you would with an 11-year-old boy. What do you think about that? How do you feel about that? I mean, you know, we know him well, so we have an idea of obviously what he likes and doesn't like and how he generally feels about things, but just kind of, you know, just having a chat. You want a drink of water, Lukey? Do you want to drink some water? Okay, we'll try later, okay?
I've had these dreams where I'm sitting down and with Catherine, and Luke starts talking to us, and he starts speaking like a university professor.
Just think that, honey. You're going to hurt yourself, okay? Okay, great work. Thank you.
Yeah, there are times would I really like to have a conversation with Luke. Hey, you know, do you like this girl, or how was school today? And I can't get a straight answer from Luke. I do know how school was because I can see it on his smile. I can see it on his frown. I know the sort of day Luke had immediately. I know when I open the door, Luke runs up to me and he wants to say something, and he's so excited to see me that he can't because he doesn't really have the capacity. But he's just like, and I just sit there and I stare and I wait for the answer. But the reality is I have it.
He's trying to pack up. Should we put that in the bag? Where are we going to put that? Okay, we'll put that in the bag. We'll put those in the bag. There's a lot of intelligence in Luke. Okay, there we go, all closed up. We're all done, sweetie. We'll put it he's very observant and he's very visual. You kind of see the external wrapping, and it's not really indicative of kind of what's going on with him. Just rest. Shh, shh, shh. No, Luke, you light? Okay. He's such a delight. He's so positive. He's so much fun. He's got a kind of healthy stubbornness about himself. We'd like to wrap him in cotton wool, and he refuses to let us do that. He seizes every day. When we see him like that, it inspires us to be the same way.
There's a smile. There's a smile. Well, you always think because my child's of limited intelligence that you won't get as much out of the relationship. But the reality is the surprises come out of the happiness, and happiness through simple things. Luke loves riding trains. You look at the smile, you look at how happy he is. It's just such a simple joy for him. So I think as a father, that's where some of the surprises really come from.
You just lie down. It's all gone. Let me put it away. There you go.
It's like picking a needle out of a haystack here. It's difficult.
Just take your time.
Yeah, I'm doing that, don't worry. Just try to relax your foot. You see, you're tensing.
Don't look at me, look at my feet.
I don't need to look at your feet. I'm telling you, I'm going on feeling.
Yeah, just where you were, I felt something.
I have a tremendous amount of pressure from my mum to get married. Oh my God.
There, this is it. Move a bit there.
Although I haven't met anyone yet, that's the difficult part.
I'm telling you, I know.
I know you know.
It's my feet, so
I know, I'm not
it.
disagreeing. I'm just trying to think. I've got 3 brothers and sister, and they've all got kids. I've got 10 nephews and nieces from my immediate family.
Now, take it out.
Definitely in there?
I'm telling, this is it.
Yeah, okay. So it's a kind of this expectation that I'm gonna get on with it now. Oh.
What? Did you find it?
I hope so.
Let me see.
We have a boy.
Oh man, you got it.
Yeah.
Problem solved.
Problem solved.
I'm alive. Good. So I show my mom.
Yeah, it's fine.
Because Joe is so scared.
Yeah. Parents will always worry about their children, no matter how old they get. It's an unconditional love, the love of a parent for a child. And to have that is a beautiful quality. And when it's gone, you really miss it. You really do. So it's all out. Good news. Nothing broken inside.
Good.
You need to go to pharmacy now, get antibiotics. That's not good. You don't have any shoes or anything, do you?
No, I can't put shoes. It's hurting me.
Yeah, fine. Just use it as a sock. Okay. All the best, all right? I think the day I got my results from my exams, I got a call. I found out that my dad had a stroke and he was in the hospital bed. So sort of the joy of passing was immediately ripped away. And I went to the ward and I still remember him lying there. And you know, the fact that I passed brought him so much joy. It was a nice feeling, and it was worth it for that. And then he was always very proud of me, and it was only a couple of years after that he passed away. Brings me a lot of comfort, knowing that I brought him joy and I made him smile, and you know, I'm very happy that I do what I do, because I know he was always proud of me, and that's a comfort you have for the rest of your life. I'm glad I have it. Anyway. I'm gonna be next door. I've got enough to see. I'll come back after.
You know, we went through such a horrific time when he was little, but you come out the other end and you realize, okay, this is different than what I was expecting, but actually it's not awful. It's actually very valuable and it's very positive.
If you saw people on the tube and they're acting sort of strange, in the old days, I would just be inclined to shy away from them completely. But now I'm not. I'm actually, oh, here's something a little different. Maybe this person needs my help. Or if there's someone behind a counter and they're counting the change relatively slowly or not in the way, or not as quickly as you would do it. I think in the old days, I'd become frustrated with that. But nowadays, now that I've learned to accept people with disabilities more, I'm a lot more patient with other people.
So we have got a 29-year-old female, high-speed RTC, complete below-knee amputation of her leg.
She had just had the pipes taken out, and I went over and gave her a cuddles, and she said to me, so I'm getting a bit of a lump in my throat here, because she said to me, but I've only got one leg, Grandad. Well, I just could have run away. I could have absolutely run away. But I thought, I've got to be strong, and I said to her, I'll give her another cuddles, and I said to her, look, love, I said, you'll be all right.
Knowing that you was that close to death and you survived, especially when I was one of those people that would never have happened to me. That never happened to me, and it blinking well did. I was like, oh, definitely lucky to be here. I am a person that likes to set myself goals. I could have either gone up or down, and I nearly went down, but I had so much support around me that I went up, and it's the support and my family and everything that's just kept me moving forward.
Here she is walking today with just one stick. Wow, this is phenomenal.
You just really have to pick yourself up and carry on going, because at the end of the day, there's always someone worse off than you. And I survived.